Welcome back. Is your pet fidgety and always scratching? There may be a problem under that fur coat. Here to tell us all about the Southeast Veterinary Dermatology and Ear Clinic are Dr. Randy Thomas and Dr. Lisa Akusevich. Good to see you guys.
Hey, how are you doing?
See you.
Now, a lot of times you can't see a dog's skin, so how do you know there's a problem there, Randy?
I think that's a good point. Most of the time they manifest skin problems by scratching or rubbing, licking, chewing, a number of things. And then eventually, as they start to lose their hair, it makes it a little bit easier to see what's going on with the skin.
Now, if they start to lose their hair, I mean, is that a problem that's reversible? I mean, I see a dog lose their hair and I think, oh no, it's going to go bald. Will it grow back?
Yeah, almost always it'll grow back once we kind of figure out what the source of the itchiness is or the inflammation, kind of get things settled down. Almost always the hair will grow back and they'll look totally normal.
Okay. Now, Lisa, what are some of the causes of these skin irritations and ear problems that folks have?
Most often we see are probably pollen and environmental allergies. That's pretty much most commonly what we see, starting between the ages of 6 months and 3 years. For the most part.
So usually early in the dog's life you see this.
Okay. Yes, not later.
Right.
We also see food allergies occur at any time in a dog's life and can be anywhere in the distribution of the dog. So ears and rear are most commonly seen, but can also be foot lickers, and they can have ventral abdomen problems as well.
Now, are there some problems that maybe are perpetuated by the owners, maybe washing a dog too much, washing a dog too little? Can those cause problems?
I think that they can, but when you have a dog with skin disease, often we do have people wash and bathe their dogs more regularly because their skin is very different from the average dog. An average dog probably doesn't need to have a bath, 2 times a week or once a week, probably once a month or every 6 to 8 weeks.
Okay.
Unless they're in the mud.
Unless they're in the mud and they're just dirty from that.
Yeah.
Now, Randy, how do folks normally come to you?
Well, mostly we work primarily through referrals, and so we really want people to have a regular veterinarian. They're a really important part of their animal's care. And so when they've got a difficult case, they'll refer the case to us, and we, we'll do a little bit more. Sometimes we do a lot of allergy testing, just like they do in humans, and kind of work the case up a little bit further. So
now, sometimes, what would a person notice at home to say, hey, my pet really does have a problem here?
I think the main things we see, excessive itching or scratching. Recurrent skin infections or recurrent ear infections, those are fairly common. Foot licking, and I think when it rises to the level that it's affecting the dog's life, they're keeping the owner up at night, they're losing hair, things like that. I think that's probably time to start addressing it.
Now, we've talked a little bit about skin allergies and things like that, but are there also some other things like mites and fleas and things like that that could cause problems?
Absolutely. We see a fair number of flea allergic dogs, and most of the people we see, or dogs we see with flea allergy, and particularly cats with flea allergy, the owners never see fleas on them, and so that's a difficult one.
Right.
And we do see, especially in younger dogs, some mite infestations that are fairly straightforward to treat once we diagnose them.
Okay. And Lisa, would you say there's anything that pet owners can do at home to maybe prevent any problems with the skin, keep maybe preventative medicine type things they can do?
Well, it just depends on the extreme. If you have, a pretty subtle case, I think early in the season and your dog is going to have a seasonal flare of allergies, maybe starting out a month beforehand with maybe some antihistamines, but consult your veterinarian about the dose and what type of antihistamine you could use. Regular bathing to keep the allergens off the skin.
Okay.
If they notice a dog that goes, I have a lot of clients that notice the dog that goes out in the runs in the park, comes back and is severely itchy, washing those allergens off, wiping them down with baby wipes, or just even hosing the dog down.
And another thing I've noticed too at home is once you have a pet, make sure to change that air filter in your air conditioner often.
Yep.
Right. So,
and we do identify, we do a lot of allergy skin testing, and we do identify a lot of dogs that are house dust mite allergic and house dust, and we do make those recommendations therefore when they are definitely allergic to those allergens.
Perfect. Well, guys, thanks for keeping our pets healthier.
Thank you.
Thank you.
And if you need help, they'll take good care of you. All right. Well, up next this weekend is Going to the Dogs, details on Paws in the Park, and a special guest in studio with the Charleston Animal Society next.